remind him that the last time he sent the money, it was not enough to buy all the provisions.
Oh, sorry, I forgot to tell him.
Are you guys talking about money transfer to buy provisions?
Yes.
But don't you know about Baluwo?
Baluwo? What is Baluwo?
Baluwo is a service that your son can use to send provisions directly to you guys from the shop. And you don't have to worry about the exchange rate.
Tell me how Baluwo works.
It's very simple.
Just log on to baluwo.com and shop, or download the app on your phone. You can shop on the website or using the app to buy online basic products for your family and friends. With Baluwo, you decide what your money is spent on. Your money, your choice. Buy online products for your family and friends in the Gambia, Senegal, Nigeria or Mali. Baluwo, better than sending money.
Are you thinking of owning your dream homes? EJ Investment is here for you. Secure our quality bungalows with 2, 3 or 4 bedrooms, or our story buildings 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
Good afternoon to you all. My name is Amadou Bari. I'm the Information Public Relation Officer. Sorry about that. This is going to be a brief handing over ceremony. We are doing this on behalf of the Gambia Association of Public Health Officers. And we are going to have an opening remark, which will be done by myself, after which we'll have a statement and a presentation of the sanitary equipments on behalf of the association by our president, who is the director of the Directorate of Planning and Information within the Ministry of Health. Then we will have a statement by the acting Director of Public Health, Dr. Manjang, Buba Manjang. And then we will have a short statement from the Director of the Health Promotion and Education Directorate, Mr. Modun Jai. Then we will have a closing remark by the Secretary General of the Gambia Association of Public Health Officers. Yeah. So without wasting much time, I would like to invite the President to give a short statement and present the items on behalf of the Gambia Association of Public Health Officers.
Good afternoon, ladies and gentlemen. Good afternoon, the Director of Health Promotion, Mr. Monunjai, the Acting Director of Public Health Services, Dr. Banjang, the Secretary General of the Association, Musa Jallo, and Bakar Kinte, the Treasurer, and my humble PRO, the media, senior officers from the Ministry of Health, and all other protocols duly and respectfully observed. My statement is going to be very brief. We all know that we are in COVID-19, response period, and we all know government cannot do it alone. And as an association, our members are the one on the front line. Our members are the one who are doing the contact tracing, and our members are those that are in the rapid response team. And when you look at the risk category, our members, our association members, are the one who is actually at risk. When you look at the analysis during the the initial outbreak in UK, you will realize that when the pandemic started affecting UK, 20% of the total number of cases were healthcare workers. So this necessitated the Association of Public Health Officers to conduct a rapid assessment to see how exposed our association members are in relation to the fight against this COVID-19. So after the assessment report, we've toured the entire length and breadth of the country. We went through all the points of entries. We went to all the remote health posts where our personnel, our association members are, to talk to them, to know what actually they are doing, and to know the little constraint, and to also identify the gaps, which we can quickly fill before government chip in to actually, take care of the, business as usual. So after the assessment, we picked out 5 critical issues, among which our members, felt they need the, hand sanitizers, sanitary materials to be more specific, because, government have provided some PPE, but these hand sanitizers and sanitary materials are very key to their operations because they, they get close contact with suspected individuals, and they also get close contact, because they are contact tracers, they moved, very frequently to the community. So they need to be protected. This is why we came as an association. We mobilized our little resources that we have, and we procure these materials to also give, to the MOH, Ministry of Health, so that at least Ministry can also distribute it to our frontline healthcare workers, at least as a token of the association's support towards the fight against COVID-19. One thing I want to privilege you with is this current fight that we are in. It is more of a public health intervention than any other intervention. Currently, we do not have more cases. And as a country, as a developing country, we need to put more efforts on the preventive side than on the treatment side. We have seen even the developed countries how they are struggling in terms of treatment. So as a developing country, we have to invest more on the preventive aspect, before we actually wait for the cases to actually come up. So this is why we want to tap our members on the shoulders to tell them thank you very much. We recognize the risk you are going through, and we will definitely stand by you to make sure that we fight this cause together. And for all public health officers in the field, we want to thank you for taking your time, for taking the risk to be there, and to be there even odd hours. And our members, in some facilities they visited, in some border posts, they visited the border posts at 10:30 p.m. There were officers on the ground. They are not on shift. They are on the ground to do the work, to protect you and I. And I think they need to be commended, and they need to be praised, and they actually need to be motivated to make sure that the job that they are doing is actually done well. And to the rest of the people here, media is very crucial in the fight against COVID-19. And I want you to use the tool that you have to educate people, to sensitize the communities, to change behavior. Mondia will tell you behavioral change is one of the most complex and the most difficult issues. People will tell you smoking, the person who will start before you will tell you smoking is dangerous. And the next minute he goes and you see him with a stick of cigarette. So this is how complex behavioral change is. So we want you to also continue the good work that you are doing, and to be also there when the healthcare workers need you to sell the good work that that we, the health workers, are doing, and to also encourage us to do more. Because the more we protect you, the more advanced the economy is. Because now COVID-19 is linked, with economic growth. All over the world are now thinking about stimulus package. So we Gambians don't want to talk about stimulus package. We want to make sure that where we are now, the 9 cases, stick to those 9 cases. And the only way we can is by the public health interventions that we currently have in place. So on that note, I want to thank you all for coming, and then thank the Director of Health Promotion and the Acting Director of Public Health Services for witnessing this handing over. Thank you all.
Just to emphasize some of the points that he said, the focal persons for disease investigation and response are public health officers, and currently, and even before COVID-19, they are busy interacting with communities, trying to find cases and report them as soon as possible. So it is true, we must recognize this effort. Thank you, Mr. President. I would now call on Acting Director of Public Health, Dr. Buba Manjang.
I seize this opportunity to thank Gambia Association of Public Health Officers for providing these materials that are highly needed in this crusade, that is the fight against COVID-19 across the country. As Acting Director of Public Health Services, I felt very happy for an association that I'm associated to come out to provide such relevant materials. Since January, public health officers have been at all the points of entry. Although they are not working alone, we are working with stakeholders to provide preventive mechanisms at those points of entry to protect our general masses. That is to protect the Gambian population from having the disease. So for that being the case, we are still continuing on this crusade. Having the quarantine, if you look at the quarantine sites, you look at the contact tracing, and you look at the fumigation team, you look at the WAS, that is water, sanitation, and hygiene, we have them at the field. They install hand washing materials at public places, communicate and talk to the masses to use them. These are all individuals, health personnel, working together with all partners. And you have among them all sectors. You have public health officers, rendering such services to our country. As of we are now, I'm very happy to receive this on behalf of the Honorable Minister of Health, Dr. Ahmad Lamin Samate, for providing these materials to us, and then this will be evenly distributed and it will be utilized. I promise you, it will be utilized as necessary. One thing that made me very, very, very happy is we all know government cannot do it alone. So when I went around to check all the border points, I came across some challenges, of course. We put it in our report to forward it to solve it. They went around, they noticed similar issue at Misra in LRF, that the border point there. They provided it. That's part of these materials. So this shows that we are all together in this. I am employing and encouraging all Gambians to emulate what this association has just taken place. That is, let us come together and fight against this virus. It is not time to castigate people. It is not time to be busy on social media trying to undermine efforts of the government, but it is time as Gambians we come together and fight this dangerous disease. Nobody will argue with you in this day, this modern generation. There is, we are in a global world. There is this satellite TV all over. You all know. You know what is happening in America. You know what is happening in Italy. You know what is happening in Spain. So I will not waste time to argue with somebody who doesn't want to understand, to say this virus is not existing. Please, I'm urging on all Gambians, forget about that argument, come forward, and then let us know what is your contribution. Let us work together to get this disease out of the Gambia. Thank you very much.
Thank you, Acting Director of Public Health, Dr. Manjang. I would just say that Senegal is our next door neighbor. Our brothers and sisters are there. And it is obvious that Corona is real because it's in Senegal. And nearly almost all of us have a neighbor, a relative in Senegal. Yeah, I do. So let us try to encourage our communities to partner with us to fight this dangerous and fatal disease. I would now call on His Excellency Modou Njai, the Director of the Directorate of Health Promotion and Education. Sir, you are please welcome.
Thank you very much, Mr. Chair. I think as speaking from the President and also the Acting Director of Public Health Services, actually I'm very happy to be here and to witness this important occasion. By the way, I'm also a public health officer, working throughout my life as a public health officer, and I'm also happy to see this association coming up with this initiative of supporting our fellow public health officers and also to support the agenda of our government in trying to contain COVID-19 in this country. I'm a proud public health officer today. I think I've worked for this country as a public health officer for 26 years now. So as a public health officer, so I'm proud to be a public health officer. Having this donation, seeing it here, I think is something that is showing people that we are ready to work, and then we are ready to go to anywhere in this country. And we've crisscrossed this country, others like myself and my colleagues, and then now it's also having these materials to be sent to our colleagues in the rural communities is also a way of encouraging them for them to continue to do the work they are doing. I always want to quote our father of public health, if you can all remember, Edward Chadwick, from 1800 to 1890. And this guy is somebody who really have been focusing on public health, and then it's because of him that we have the first public health act globally, and in the UK, and also coming back to other countries. And it's also because of him that also we have focused on public health, and he has also written a report called the Report on the Living Condition of People Living in Great Britain at that time, when people were living on sanitary conditions. And then that report regarding the sanitary condition of people living in Great Britain at that time brought about development of public health globally. And I think having these sanitary materials also is also another function of public health, and I think this will also help us to move the agenda forward. And then also he has also emphasized that you can also be able to address public health issues through collaboration, intersectoral collaboration. Specifically, he has mentioned that, and also he has also emphasized on partnership. And I think we have also seen, what we have also seen here is another way of partnership, using our approach of the whole of society approach. We have also seen now the society, the Association of Public Health Officers are part of the society, coming together, mobilizing themselves, mobilizing resources to come and support the efforts of the Minister of Health. So what we can now say, we are so grateful to the association. We know that you have a leader, the president of the association, Mr. Jibril Jajo, who is happens to be our colleague also, who is also Director of Planning and Information at the Minister of Health. We are very grateful to him and his entire team for having the foresight and also for thinking and also to contributing towards the fight against COVID-19. We have to do this together. We're also calling for other partners and other stakeholders, other associations. Each and every association have a role in this. We are calling on other associations, even outside the health sector, for them to come together and support our agenda in fighting COVID-19 in this country. And we can do it together. So what we can now say, we have to thank the association very well, and I think these materials, as Dr. Manjan rightly mentioned, they will be put into the right tools and be taken to the right places that require them. So on that note, today I think is the happiest day in my life, and it happens in a month that is I'm celebrating my birthday. So I'm happy to be here with you as members of the association. We always are here to give you guidance and support, and we will give you the courage and at all time for you to do more of this type. And I think you can do it because the talents we have put in place there, the young ones that are there, we have seen the zeal, we have seen the energy in them, that they want to move the agenda of public health in this country, and we are behind you. We will give you all the support that is required, and I thank you for definitely this donation. Thank you very much.
This one, during the assessment, we realized that Misraba border, our colleague at the border used to trek around 30 meters to go and fetch water to come and put it in the hand washing. So we thought that it would be very helpful for the association to at least bridge that walking distance so that they can also concentrate rather than walking to go and then fetch water. You just fix the pipe and then it kills the fish. So acting director, this one is meant for Mr. Abba. Yes. Yeah.
Oops, sorry.
So, Yes. That is summer border post, so that the officers will not trek to go and then feel the hand washing time. Instead, this will be very useful to support them.
Finally, I would like to invite the Secretary of the Gambia Association of Public Health Officers. Before closing, he would briefly tell you a little information about GAFO, that is the Gambia Association of Public Health Officers, and finally close the meeting. Thank you.
Good afternoon, Director of Health Promotion, Director Planning and Information, the Acting Director, Public Health Services, media personnel, and other dignitaries. I want to say good afternoon to you all. GAFO is the Professional Association of Public Health Officers in this country. The association has been in existence since 1971, and currently we have over 400 members, of which most of them are working for the Ministry of Health, and we equally have a lot of them working in NGOs and other parastatals in this country. So it's really not a small association, and its existence has already spelled out that it has been existing for so long. And then we have been partnering with the Ministry of Health for so long. This is not the first of its kind. We've been partnering through health promotion activities and education. And then we've equally been supporting our members. We have some members that have passed away and left families. And then the association have been supporting these people. And we have members that are in need. Some of them were in the job and then had issues and they can no longer work. The association is supporting these people. And we are equally supporting students, especially the Health Promoters Association of the Gambia College and the Students Association of Public Health at the University of the Gambia. So virtually GAFO is doing a lot in terms of partnership and collaboration. And we want to assure the Ministry of Health that we will be available always to help support them in development agendas, especially that has to do with health. So this is an association, we are definitely proud to be associated with the Ministry of Health, and I want to thank everybody that came to this presentation. And I want to say to all public health officers, from Kartong to Koina, Nyamanar to Amdalai, that we are proud of you all. And then we want you to continue the good work that you are doing, irrespective of what happened. This is Gambia, it is our Gambia. And be assured, GAFO will always be there to help support you in times of need. I want to thank you all.
Thank you very much for being here with us. It's been a pleasure. On that note, finally, he has closed it already, so I don't know what I'm doing here right now. So thank you very much for coming, okay?
Agada di.
Mbijan aganya.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la.
Ha, code nyinji.
Okay. Korsan. Nsila ID soto.
Ah, sa soto. Sorry. Agada di.
Mbijan bro.
Albaka.
Mbaka.
Bara alla service o tariaka.
Ah,
mbale. Mo ki janna nun kunu bara tariaka.
Jannom yona forest de bureau. Gambia tonkon na no mbali ya bere. Birim koyna fo kato.
Bari si kodo kino kato ni fo bolong blabe to.
56 branches mola sota Gambia jang.
Ha?
Gambia kono ani Gambia e bantala bankol. Nko kono kiya bere. kodo sifa fo falindiro fo nyaadi lafta memmen na kodi to poto nin kodi maraw jannam number 1 di nyonta andum fana nata anoda enterprise sotale wala nyindi ko domorol fana kol fana be firale le dadi man domorol dir fana beteat Gambia dawda yalo ngam fa kendol sotale je
wo moy wadiat
apelenta
ni wo ka ni lafta nyelen kendol e binaji
yalo bukani la ko la baraka ba
yalo ndel ciosano lo
baraka.
When we touch down, better broke down.
With Gamtel G-Fiber, now you can enjoy super fast internet in gigabytes. G-Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G-Fiber, the future is speed. Gamtel, creating a brighter future in communication.
That's how she became mine and see that.